We're here today with Jeff Kress. He is a longtime friend and a patient here in the office, and we just want to share some insight of how we've been able to help him. Jeff, give us a little bit of background of you as an athlete.
I started playing sports at a very young age, and as far back as I can remember. I played soccer, football, baseball, basketball, did a little track and field, all the typical sports. And then when I was 15, I started racing bicycles full time, and it was road bikes, so the bikes you see in the Tour de France, that type of racing. And by the time I was 17, I was on the U.S. Junior Development Team and spending time at the Olympic Training Center in Colorado Springs. And then when I was 23, I was on the U.S. National Senior Team, so I was trying to become an Olympian and spending a lot of time at the Olympic Training Center and racing in Europe and throughout the United States and South America. And then I went on to get my master's and Ph.D. and after I earned my Ph.D. I started racing again, doing master's races, and I did that until I was like 38 years old.
Just one side note, I mean, you're a specimen, you're in great shape. Do you mind sharing your age?
Oh, I'm 52. Yeah. So and now these days I still ride just a little bit, but I surf almost every day, and
wonderful.
Hike with my wife and fish with my son and stay pretty active.
Tell us a little bit about your professional background, your occupation.
I'm a professor at Long Beach State, and I teach in the Department of Kinesiology, and I teach future PE teachers how to teach PE. And then I'm also a generalist and teach some of the general ed courses as well.
And then also let us know just a little bit of history of, we'll call it your sports injury, but your musculoskeletal type of things that have kept you from doing what you want to do.
I've been pretty active, and along with being active, I've had a lot of accidents throughout the years. So to the tune of, I've got 14 broken bones all at different times, so it's 14 different accidents and 16 different surgeries. But the most limiting thing that has happened within the past several years is about 9 years ago, I was diagnosed with a couple of tumors in my spinal cord, and those tumors were removed. But in order to get to the tumors in the spinal cord, they had to do a laminectomy, which is cutting off the back of the bone of the vertebrae.
Sure.
And so they had to do 3 of those at my T3, 4, 5, and then 10, 11, and 12.
Just pause right there. You had it done at one of the most premier centers in the country, right?
Yes, at the Cleveland Clinic. So I was fortunate enough to be back in Cleveland when I had a lot of symptoms come up and went to the hospital, not knowing what they were. And I was in the right place at the right time. Anywhere else, they said I probably would be paralyzed, if not worse.
And just following that forward, what type of treatment did you try from, I know you've had pain management with injections and a lot of rehab. Just kind of give us a little bit of how long you did it and how it may have benefited or not quite there.
The pain started within a couple of years of the surgeries because of the trauma that was done to my spine at those areas of the surgery. There was scarring that took place, and that scarring actually fused the spine together. So I essentially am fused in, well, up and down quite a bit of my spine. So as a result of the fusion, I have flexion only pretty much at my neck and then down my lower lumbar area.
Sure.
And then also as a result of the scar tissue within my spinal cord, I've had radiating nerve pain coming out into my rib cage. And so that's been going on for the better part of 7 years. And then recently, within the past couple of years, I started to develop a lot of pain radiating down my right arm, super hypersensitivity, so that any clothing on my arm felt like sandpaper.
Wow.
Any type of breeze blowing on it feels like fine sandpaper. I've got pain in my ribs that feels like somebody's just kind of poking it with a couple of fingers. And that pain for the past 2 years was progressively getting worse and worse. So the treatments I've been receiving for that have been a number of injections.
It was steroid, right?
No. It was some type of other I'm not quite sure.
Sure.
Or what it was. And acupuncture, and we worked with core stabilization therapies, trying to stabilize the whole area. So, and the pain just kept getting worse.
Difficult sleeping?
Yes, yeah, my sleep pattern was greatly interrupted.
Okay.
I'm a light sleeper anyhow, and that just really messed with it.
I'll share with you what we did differently with Jeff. It's always been kind of in the back of our minds here that if we took someone with a sports injury and we looked at not just the musculoskeletal side, but we looked at their physiology or the systems, that we could put them in a state where they could actually recover. And so what we did with him was a full workup with blood work. We identified some key markers to us, inflammatory markers, oxidative stress markers, and actually a little bit of genetics. And we found out that he really couldn't process the B vitamins well in his system. That's kind of how he was born, how he came from the factory. So one of the things we did on that side is he went through a detox program with the IV, and we loaded it up with a lot of the B vitamins. From the rehab standpoint, we tried a total different approach. Most of the rehab he had up until this time was looked at putting the neck and the back in a safe position and training all the secondary stabilizers around it. Gave him some benefit. But what we did is we did a thing called foundation training that you can look it up on the internet, that really goes right at the strengthening of the spine in its strongest position while it is being decompressed. We added to that, our medical director, Dr. Raleigh, had done some strategic injections just with an anesthetic, no steroid, along the nerve pathways. And then I worked on him and Dr. Raleigh worked on him. And why don't you just share, you know, I think you came in the end of October and here we are, we're first part of March. Yeah. Just share how you've done.
The recovery was a little slow at first, but it really picked up steam, and probably within about a month I started feeling better, and then feeling better and better, and my sleep pattern got better. The pain that I had in my rib cage and arm subsided quite a bit. On a pain level of 1 to 10, just sitting on a couch, I was at about a 7 with no activity whatsoever. On
medication too?
Yes, yes.
Okay.
And now I'm down to maybe some nights a 1 at the most, sitting on the couch, just relaxing. So my activity level has picked up significantly through the day.
Sure.
As a result of being a lot more comfortable. And
Super.
The other benefit is I'm pretty lean, and I've been trying to put on some...
He's very lean. We would all want to look like this guy.
I've been trying to put on some mass just to add protection to my system, my long levers.
Sure.
And for the past 2-3 years, I have not been able to do that. In fact, if anything, I've been losing weight. And so we talked with Dr. Raleigh about that, and she looked at those markers in my blood work and helped me along with some little different medications. And I gained almost 10 pounds now in the past, was it 5 months. So.
And we check his whole body composition. It's been 10 pounds of muscle.
Yes.
It hasn't been 10 pounds of fat at all. Which
and my activity level hasn't changed that much.
Yeah.
So it's not like I'm working out a lot more or eating differently. I'm just...
It's really cool to see that if we optimize all the systems in someone's body that has a chronic injury, that their body wants to get better. In fact, some of the research is showing there's more genetic potential of recovering than tearing it down. So any last words you'd like to tell other people that have maybe been struggling with the chronic conditions and have tried stuff but haven't resolved?
I really believe that there's something out there that's gonna heal whatever malady exists, and the trick is to find it and find what works best for you. And I thought I had found that where I was previously, and I tried a couple other places as well. And Tom, and I had a conversation one day about his practice here and about how it's different than other other places, and I bought into it 100%, and it's worked great. So for me, this has worked really well.
Jeff, thank you.
Oh, yeah.
And just for those of you out there, it really takes a partnership between the providers and the patient, that we're not just centered on the doctor, we're centered on the patient's need, and we're looking at optimizing the systems in the body to get someone so that they recover. The other side of this is we still do use medication in this office, but we try to use it at a much less level, but also the most appropriate thing that will help them.
I think just one more thing I'd like to add is
Sure.
it's great knowing that your staff here all are active people and
Sure.
have injuries and or diseases, that you can understand the patient from a more empathetic level than somebody who doesn't really have that same world experience.
Awesome, awesome, thank you.
Right.
And anyone out there that might be seeing this video, just pick up the phone or email us and we can start a conversation no matter where you are. If you're around where we are or other parts of the country, we can kind of give you a guideline of something that you might want to try to get you resolved.
Right. Hey, I'd just like to give a big shout out to my Bolsa crew.